myself, Dr. Preeti Kadu, founder and chief dentist of Dr. Kadu's Orthodontic and Dental Clinic. Today I am going to discuss about the dental implants. The procedure of the dental implants, step by step. As we have already discussed in our last video, which are the cases in which the dental implant can be done. So for example, if there is any missing tooth, for example, single missing tooth or the multiple missing tooth, or as in old age, all the teeth are missing and we wanted to put a fixed denture, in all such cases, the dental implant will be advisable. So first, when the patient comes to us, the first preliminary checkup we do is we do a detailed intraoral examination. We check for your gums health. We check for the amount of the bone which is available in that site where we have to put the implant. How many teeth are missing? We have to take the measurement of your teeth and the photographs of your teeth. In some cases, we will take the x-rays also. In some of the cases, the CBCT scan of the jaw will be advised. In CBCT scan, generally what we see is the 3D pattern of the bone. We see the density of the bone which is available, how much width of the bone is there, how much height of the bone is there, what are the important tissues which are around that bone area. Sometimes the nerves are there, sometimes the sinus is there. How much is bone available for the implant placement? How much is the adjacent teeth in that area? Is there any infection in that area? How many teeth can we place in that area? All those things we have to study during the CBCT scan. There are few of the blood tests which are advised to the patient to get it done before the actual procedure of the dental implant is done. In the cases of the dental implant, the blood tests are advised. These blood tests are just to make it sure that the dental implant procedure will go safely. Prior to the dental implant placement, some of the medication will be advised to the patient. A detailed medical history will be taken, in which whether you have blood pressure, are you a diabetic, and are you allergic to any other medication, are you allergic to anesthesia, all the things will be checked in detail. In a few patients having a cardiac diseases or any heart surgery related procedure is already done, in such patients, the precautionary antibiotics are also given. Patients who are on blood thinners, with the help of the physician's consent, these medications are stopped for a few days prior to the implant placement surgery. In some cases, physician consent for overall fitness of the patient is also asked for. Once we are ready with the CBCT scan, we have studied in detail that how many implants has to be placed. For example, in few cases, single tooth implant, so there will be only one implant. In some of the cases, there is 3 or 4 missing teeth. In such cases, we have to put the 2 implant and on top of that, we have to put the bridge. Like this. Now here the 2 implants are placed and on top of that, we can put a bridge over here like this. Or there are some single implant cases in which a single implant is placed into the bone and on top of that an artificial crown is placed like this. And in old age patient, when all the teeth are missing, we have to put few implants depending on the patient's condition of the bone. That we decide whether we need to put a 4 implants, 6 implants or the 8 implants in the lower as well as in the upper. And on top of that, a denture will be placed. So once we are ready with all the treatment plan, an actual appointment of the implant placement will be given to the patient. In that appointment, the proper sterilization protocol and the disinfection protocols are followed. Local anesthesia is given to make it sure that there is no pain during the procedure. Sometimes a small cut into the gums is given and a small hole into the bone is made with the help of a special implant drills and the implant is placed. The actual procedure of placing the implant in the bone might take quite a lesser time. Once the implant is placed, sutures are given. Sometimes the sutures we have to remove after 7 days and sometimes the resorbable sutures are given which get resorbed on itself in the gums around it. A regular follow-up of the patient is done every 4 days, 5 days initially. Once we make it sure that the initial healing has happened, the patient is kept on a waiting period. So now what is a waiting period? Once we put the implant inside the bone, implant takes some time for the osseointegration. Osseointegration means the implant threads get integrated with the bone. It gets united with the bone properly. Generally the waiting period, in case of the lower jaw, it is around 2 to 3 months. In case of the upper jaw, we require more period. So in some of the cases, it might be 3 months to 5 months also. Waiting period for the healing of the implants, it also depends on the health of the patient. In some of the diabetic patient, it may require a little more time. Once we are sure that the implant has been osseointegrated in the bone, it has been fixed into the bone, it is stable now, then we actually go for the second step of the procedure, that is putting in abutment. Abutment is put inside the implant by doing a second surgery in some of the cases. And again, the gums are closed. In your next appointment, a measurement for the artificial crown will be taken with the help of an elastomeric materials. Trial of the crowns are done during the next appointment. Once we are sure that the crown is fitting well, the fitting is good, the accuracy of the crown is good, then we fix the crown in your next appointment. Fixing of the crown on the implant is done with the help of two ways. Sometimes the crown is just cemented on the implant abutment, or sometimes the artificial crown is screwed on top of the implant. In your case, which type of the crown fixation is required, that will be decided by your dentist. Once your crown is placed, now you can chew with the implant supported artificial tooth just like any other natural tooth. Oral hygiene maintenance in case of the implant is very essential. As it is with the natural teeth, you have to maintain your teeth, you have to brush it properly, you have to rinse properly, you have to go for the regular checkup to your dentist. The same things are applicable with your dental implants as well. If your dental implants and the health of the tissue around the dental implant is maintained well, the life of the implant will be very longer. Regular follow-up every 6 to 8 months with your dentist, and scaling of the teeth, cleaning of the tartar and plaque every 8 months to 1 year is very essential. As an implant is an artificial tooth replacement for your natural teeth, you also need to follow some of the food instructions. You need to avoid very hard food and very sticky food with your implant tooth. Very hard food like directly eating on an ice cube, or in case of the non-vegetarian, directly eating or chewing on a bone, or eating anything which is extremely hard, or eating anything which is extremely sticky has to be avoided, which will enhance the life of your implant. In some of the cases, patient may feel that the implant has become loose. In such cases, immediate attention of your dentist is required. Your dentist may check it. Most of the time it happens like that, the crowns which are fixed with a screw are sometimes become loose and the patient feels that the implant has become loose. So in such cases, just fixing the screw will solve all the problem. The bad odor in your mouth, bleeding around the implant, or the swelling around the implant should not be ignored. It should be treated as early as possible. That is all about today's session. Thank you very much.